conditions identified by the CDC and who are at higher risk for exposure. While clinical trials are showing safety and effectiveness for adults, children will not initially receive vaccines, as these clinical trials with children are needed to assure the safety and effectiveness. Okay, I know that was a lot of information, so let me recap a bit. First, COVID-19 vaccines must go through and pass clinical trials like any other drug or vaccine. Pfizer and Moderna did recruit people from historically marginalized populations to participate in their clinical trials. The vaccine authorization process is independent and transparent. There is no COVID virus in these vaccines. Supplies of the vaccine will be very limited at first, and these initial supplies will go to long-term care staff and residents and a limited number of hospitals to vaccinate healthcare workers at high risk of exposure to COVID-19. Again, those who are caring for or cleaning the areas used by patients with COVID-19. We at the state have been hard at work preparing for this moment, but this is big. We know there will be bumps in the road administering a vaccination program of this scale. States will need federal support and federal dollars as they undertake such an unprecedented effort. As I said earlier this week, having a safe vaccine within reach is an extraordinary scientific achievement, but it's not a quick fix. It will take several months to have enough supplies that anyone can readily get a vaccine. Until most people are vaccinated, the 3 Ws remain our best tool to protect our loved ones, to make sure our hospitals are there for those who need them, and to save lives. Wear a mask, wait 6 feet apart, and wash your hands. Wear, wait, and wash. Okay, with that, I will turn over to your questions.
Our first question today is from Hannah Critchfield with North Carolina Health News.
Hi, Dr. Cohen. Thank you for taking my message or my question. I wanted to ask you about the distribution plan after it goes from healthcare first responders and into that phase 1B when prison staff and some high-risk prisoners will start receiving the vaccine. I was wondering if you could talk a little bit about the logic behind the decision to vaccinate all staff and then some high-risk prisoners rather than opting to first prioritize vaccinating all prisoners, just given the rate of spread. And then as a second piece to that, I was wondering if you could talk a little bit about if in that phase 1B, if there are limited doses to the point where you couldn't vaccinate all staff and all high-risk prisoners, how those doses will be prioritized between those two groups. Thank you.
Well, thanks for that question. Let me back up and explain the prioritization of how the limited amount of vaccine that we have at first will go. So as I mentioned, we expect that that very first week there will be one vaccine available. And that one vaccine we think will likely be the Pfizer vaccine. We think that first week we'll get about 85,000 doses, and we will distribute those 85,000 doses to a number of hospitals. We won't have even enough to get it to every single one of our hospitals. It'll be a limited number of hospitals. So we'll distribute those 85,000 doses, and the hospital will then be vaccinating, again, healthcare workers who are at higher risk of exposure, meaning they're working directly with COVID patients or cleaning the areas for COVID patients. Additionally, we will be allocating, likely starting from our second week of vaccine allocation. So that first week is just healthcare. By the second week, we anticipate we may have vaccine from as many as 2 manufacturers, Moderna and Pfizer. At that point, we anticipate being able to both send to more hospitals as well as start to do the vaccinations in our long-term care settings. We don't have exact numbers of how much vaccine we will have in week 2 and beyond yet, but we are learning more every day and trying to get that information. So we will be starting to vaccinate our long-term care staff and residents as well. And again, we had a number of external advisory bodies who created that prioritization that said we should go with healthcare workers exposed to COVID-19, go with long-term care workers and staff first. Those advisory bodies included the National Academy of Medicine, the advisory board to the Centers for Disease Control, the CDC, that just met this week and created that prioritization. And here in North Carolina, we also had our own vaccine advisory committee that was convened by the Institute of Medicine. So I want to thank all of those experts for weighing in on these priorities. The reason they came up with those priorities is like, see, we have a limited number. Where do we want to put those resources first? And we said we want to put it for our healthcare workers who are actually being exposed to COVID, as well as in our long-term care settings. As you know, that has been a place where we have some of our most medically frail folks, as well as difficulty keeping virus out of those congregate settings. When we move on from healthcare worker and long-term care, we move on to other adults with 2 or more chronic conditions. Again, these independent advisory committees said you move to that group next is because they are at highest risk for having a bad outcome from COVID-19. We've talked for many, many months about people who have chronic conditions seeming to have worse impacts from COVID. It's not any chronic conditions. There's a specific set of them. Things like diabetes or heart disease, or underlying lung disease, or immunodeficiency, problems with your immune system. Those are the kinds of chronic diseases. And we know if you have 2 or more of them, it puts you at a lot more risk for having a bad outcome from COVID. So that's the next group we want to get to. So when we think about all of those adults across North Carolina that have 2 or more chronic conditions, we also know that there are certain settings where those adults are that are more risky. And so as we think about our allocation and the work we need to do to distribute those vaccines, we want to send them not just to target the adults with 2 or more chronic conditions, but also to those settings. And that's where I think your question comes in to how do we think about congregate settings. A prison is a congregate setting, a homeless shelter could be a congregate setting, and others. And we certainly do want to go to those settings, but we are going to target those adults with 2 or more chronic conditions first because they are at highest risk of severe disease. So again, we are relying on that expertise from those independent panels to go with healthcare workers, long-term care and staff, and then to adults with 2 or more chronic conditions, while we also target them to settings we know are higher risk. So I know that was a long answer, but really want folks to understand how that prioritization works, the fact that we relied on these independent bodies of experts that really all aligned on how that prioritization should work, and we were going to be following their recommendations. Thank you.
Our next question is from Brian Anderson with the Associated Press.
Hi, Dr. Cohen. Brian Anderson here with the AP. I'll have a follow-up question for you about vaccine distribution, but I've got to ask first about COVID. There's an increase in 82 deaths that were reported yesterday, the most since the start of the pandemic. Cases and hospitalizations are at all-time highs, and for the first time ever, or first time since April, I should say, positivity rates above 10% for 3 consecutive days. And I know you and the governor reduced indoor gathering limits from 25 to 10 ahead of Thanksgiving, and there's some tougher language on mask enforcement, and additional restrictions could be on the table. But my question is, the status quo clearly isn't working, so why the reluctance to impose additional restrictions at the statewide level?
Brian, thanks for that question. And you elucidated a lot of the things that we are trying to help folks do in order to slow the spread of this virus. We knew as we're heading into the season when things are colder and thus people go inside more, we head into the holidays where people want to gather more, we knew that there is just going to be more risk of spread. And unfortunately, we are seeing that play out in our numbers. We know, though, what to do. We know what prevents this, right? We know the 3 W's work. We know wearing a mask. We know keeping your distance, limiting your interactions with other households, washing your hands, all of that works. So if we were all to follow the things that are currently in place right now, I don't think we needed to do more. But we know that that is hard. We know that we are asking a lot of folks, and it may be possible that we need to go backwards. The governor said earlier this week, everything is on the table. We are looking at other options. I certainly look at a lot of other states around the country. What are the actions that they are taking? How has that impacted their numbers? And I look around the world. What are other countries doing? How have restrictions improved or not improved their numbers, and what does that mean for us here in North Carolina? So we're trying to take in all of that information and make good decisions, as we always have through this entire time of COVID. And so those kinds of are the things that go into our thinking. I'm certainly concerned about our numbers. We can all do things right now to slow the spread of this virus. We have to, because as you said, our hospitalizations are going up and people are dying. So we need to work hard at this. Thanks.
We have a follow-up from Brian Anderson with AP.
Thanks. And we know that the Pfizer and Moderna plans are due this Friday and next. Can you just share the timetable for the release of that? And I know you said there that there's a limited number of hospitals that will get the first wave of doses. Is North Carolina distributing them to healthcare workers based on specialty or sort of number of COVID cases per capita? Can you sort of talk through that?
Let me start with your second part of the question. So we will do a distribution to our hospitals based on their hospital size. And the way the Pfizer vaccine is packaged, you essentially have to ship 1,000, it's actually 975 in a unit. So that's a lot we have to package together. So we can't actually break it down into smaller units and get it to even more hospitals, which is why when we get 85,000 doses, it can only go to so many hospitals. It can't even get to the more than 100 hospitals we have here in our state because, again, they package it 1,000 together. And we certainly don't want to be wasting any vaccine in our early days here. We want to be really efficient with how we get our vaccine out. So it will be to a limited number of hospitals. It'll be based on hospital size as well as figuring out the population. So that is how the distribution will go, again, to a limited number of hospitals, generally are larger hospitals. The hospitals themselves will then prioritize vaccination for their staff that work directly with COVID patients. So we're asking them to really be thoughtful about prioritizing to people who work on COVID units, clean COVID units, maybe part of the environmental staff, folks who are in the emergency room, who are taking care of patients where they don't know if they have COVID or not, but have a high risk of exposure. And so I know all of our healthcare teams are going through that work to prioritize that right now. So they will be handling that. As far as your other question about the timeline, we don't know exactly, right? Because the FDA is doing its good, thoughtful work on reviewing the data. That data will then go in front of the independent advisory board for the FDA. That meeting is currently scheduled for the 10th of December, so next week. We believe that after that public advisory meeting, that the FDA will be able to wrap up their work, integrate all of that feedback into what will become an emergency use authorization. It'll authorize use of the vaccine, and it'll tell us for what population it will be authorized for. That will inform who can get vaccinated. There's one more step where an advisory committee for the CDC, it's called the ACIP committee, has to also tell us and give us their recommendations of who is the right population to get that. That is the last step before we are able to take that vaccine and put it into someone's arm. So we are estimating the earliest that could happen is probably around December the 15th. That is what we were planning for at this point. Could be a few days earlier, a few days later, but that is around when we think we will have both the emergency use authorization as well as the recommendation from ACIP, and then we will be able to proceed forward. Thanks, Brian.
Our next question is from Tess Bargeber with Fox 8 News.
Good afternoon, Secretary Cohen. Tess Bargeber, Fox 8 News. We're hearing from some of our local public health departments, particularly in Forsyth County, that are needing more contact tracers, and they're saying even if they get these contact tracers, they're getting to the point with their case numbers that they know they won't be able to make contact with every single person. I was wondering if there were any new statewide initiatives to provide more contact tracers or any other prioritization efforts when it comes to contact tracing.
Yes, thanks for that question. Yes, with a record number of cases, when we put up 5,600 new cases like we are in just 24 hours, there's only so much our teams can keep up with. So we are very much aware of both needing to always recruit more contact tracers, what we do, but we really need to prioritize the work itself. And so actually our team has been working for a number of weeks with our local health departments on ways that we can prioritize that work. We've looked at what other states are doing, the guidance that they have been giving out, learned from some of our other public sector partners, and we are giving more guidance in order to better target that work. We want to make sure that we get as much information from that as possible. Again, it's still really valuable information, but what I think is important for folks to understand is that we have widespread, we have community spread of this virus everywhere in every community in North Carolina. That's why you need to take precautions as if everyone around you has it. You have to be wearing a mask, you have to be waiting 6 feet apart and washing your hands, because the traditional tools of contact tracing really aren't going to be as effective when things are spreading this quickly. We're going to keep doing that work, and our local health departments have been amazing, as well as our contact tracers and contacting everyone and staying abreast of that. But there are a lot of cases coming our way, and that's why everyone needs to work hard and really approach things as if those around you could have it, and for you to take those precautions, take that personal responsibility, say, look, I got to wear a mask, I got to wait 6 feet apart, I'm not going to go to that event, I'm not going to take that risk right now. There's just a lot of virus here in North Carolina. Thanks.
We have a follow-up from Tess Bargeber, Fox 8.
You mentioned some guidance for public health departments when it comes to contact tracing. Can you be a little bit more specific about what that guidance is and what they're being told?
It's still under development, and so they're going to be asked to really look at their cases and prioritize some of the work. So still under development as we work with our local health departments.
Our next question is from Jody McCreary with CBS 17.
Hi, thank you, Dr. Cohen. I wanted to ask about the percent positive metric. I've had questions from viewers about the way it's calculated and the specific numbers that go into it not being public. My question is, how difficult would it be for the state to release those numbers? And in terms of public understanding, what benefit might come along with doing that?
Well, thanks for that. As you know, our dashboard has received many awards for the level of transparency and the kind of data that is available on our dashboard. We've worked very hard over the course of this pandemic to make more and more data available, allow it to be downloadable, allow folks to really understand and follow along on the metrics that we use to inform decision making. We'll continue to update that information as we continue to evolve our work. As far as the percent positive, that again is a metric that helps us understand of the total amount of testing that is being done, how many are actually positive, and it does give us a sense of how much viral spread is happening across our state. So an important metric to us. The way it is calculated is based on those labs that are able to report to us electronically. So it is not the whole universe of every single test. We're very clear about that on our dashboard, about the subset of data that we use. It is nearly all, but not all of the testing data. So we do have some limitations on that total universe of data, and then we are able to calculate from the total tests that are done how many of those are positive. Thanks.
Our final question today is from Andrew Ballard with Bloomberg News.
Hi, Dr. Cohen. Thanks for being here and taking this call. I was wondering if you could go into the cold storage issue a little bit. Do we have enough capacity for shipments that are coming down the road? I saw in the vaccine plan that purchasing ultra-cold storage units was not recommended this time because dry ice could be used. Could you kind of go into that a little bit for me, please?
Yes, Andrew, great question. So for one of the two vaccines that are under consideration of the FDA, the Pfizer vaccine in particular, is one that requires what everyone's been talking about, which is ultra cold storage. I mean, it can't be in a normal freezer. It has to be even colder than that. For the initial doses, we do have particular sites that can store those over for a longer period of time in ultra cold storage. But you're exactly right, is that the Pfizer company has arranged for dry ice to be available in order to keep it at the appropriate temperatures. So we haven't needed to purchase ultra cold storage facilities or other mechanisms. So Pfizer has taken care of that from a dry ice perspective. And then the Moderna vaccine does just require regular freezer and refrigeration. So it does make it a little bit more mobile and transportable. Thanks for that. I think that was the last question, Andrew, so thanks so much. Again, we went through a lot of information today on vaccines. I know it's a lot. I know that this has been a long year. Everyone has worked really hard to keep the virus level low, and when we see numbers like 5,600 cases in 24 hours, I know it can feel discouraging, but we know what works, and it's the 3 Ws. So keep them up, wash your hands, wait 6 feet apart, and importantly, wear that face covering. So whatever your reason, get behind the mask. Thanks so much. Stay well.